Clear!
Hi, I'm the Clinical Informaticist. How can I help you?
Nice to meet you. Yes. I'm looking for an order set, something that will allow me to work up my patients, treat their disease, admit them, take care of them while they're an inpatient, and then discharge them all in the same order set. Oh, and I want the whole thing to be pre-clicked so that for me, I just want to be able to click once and all of that will be taken care of. Do you think you can do that for me?
How are you going to know if the workup results in the right diagnosis to treat the disease? And what about med reconciliation? Are you worried about reconciling meds at transitions of care?
No. Trust me, I've been doing this for 20 years. There must be a way to do this. You know, my cousin has a son who just graduated from college, and he's very good with computers. He hooked up cable at home, and very smart young man. Maybe we can get him to come in and make this happen with one click. It is a computer, right?
Oh, yeah. Yeah, good to hear he's good with computers, but I'm talking about med reconciliation. That's the process of evaluating the patient, looking at their home med list, looking at their active med list, and then deciding if the patient still needs those meds. That's hard to do if we have one order set covering before and after the entire hospitalization.
These computers. No. What? I need to be able to do it with one click. That's how my phone works. I just press one button and the whole thing is taken care of for me. That's what I'm looking for.
Always remember, no computer is a substitute for good clinical judgment and great clinical care. All right, now let's discuss some take-home points. First of all, remember that you can help reduce clicks by designing order sets around common, clear, discrete, and well-defined ordering scenarios. The more clear and the more discrete and the more well-defined, the less clicks you will end up with in the end. It's very helpful to keep that in mind. Next take-home point. Order sets are made of one or more of about 15 or sometimes 16 different types of ingredients, what we call order types. Those order types are things you probably recognize because they're very common. They include things like ADT orders for admitting, transferring, and discharging patients, code status orders, activity orders, diet and nutrition orders, blood bank, respiratory therapy, nursing orders, IV fluid orders, med orders, laboratory, radiology, diagnostic orders, special orders, consult and referral orders, and discharge education orders. And in outpatient areas, they also use charges in the order sets. Remember, that can actually help you build your own order set template. Take-home point number 3. Remember that good order sets come in one of 10 flavors. This is what helps you define those nice, discrete, well-defined order scenarios. And again, they'll probably look fairly familiar. What I find very helpful is to categorize them based on what they do. So admit, transfer, and discharge order sets function exactly as described. Workup for working up a chief complaint, treating for treating a new diagnosis, monitor for monitoring an established diagnosis, prep and post before and after a procedure or operation, panel for a common building block used in order sets, and protocols. We'll talk more in a future video. All right, bonus question. If an order set is a collection of panels and orders used to standardize and expedite the ordering process for a common clinical scenario, then what is a clinical pathway? Well, the answer, a clinical pathway is a collection of order sets used to standardize inpatient care for a common diagnosis or a procedure. All right, thank you very much, and stay tuned for our next video.